If you are 55 years old or more, don't let your doctor do this to you. As we age, our health decisions become more critical, but not every medical recommendation is in our best interest. In this video, we'll uncover 7 things you should never let your doctor do after 55. These insights could save you from unnecessary pain, prescriptions, and procedures. Stay until the end because protecting your health starts with knowing what to question. Number 1, don't accept every prescription without questioning it. The biggest mistake is blindly trusting every pill given to you. Mr. Bernard, a 60-year-old retiree, always followed his doctor's advice without hesitation. A mild headache, a prescription, slight joint pain, another pill. Within a year, his medicine cabinet was overflowing. What started as minor discomforts turned into constant fatigue, dizziness, and stomach issues. One day, after nearly fainting, he discovered that some of his medications were interacting dangerously with each other, a risk he was never warned about. This happens more often than you think. Many doctors prescribe medications based on symptoms alone, without considering lifestyle changes or alternative solutions. Pharmaceutical companies flood the market with new drugs, and unfortunately, not every prescription is about what's best for you. It's about what's convenient, routine, or even profitable. Here's the truth. Not all medications are necessary, and some cause more harm than good. What you should do. Instead, ask the right questions before accepting a prescription. Ask, what happens if I don't take this? Are there lifestyle changes that could help instead? Is this a long-term solution or just a temporary fix? Research the side effects. Doctors may not always explain them in depth. Look up the medication yourself, check for interactions, and understand what you're putting into your body. Get a second opinion. If a doctor immediately prescribes medication without exploring alternatives, don't hesitate to seek another professional's advice. Prioritize natural alternatives. First, in many cases, dietary changes, exercise, hydration, and proper sleep can reduce the need for medication altogether. The goal isn't to reject all medicine, it's to make informed choices about what truly benefits your body. Because once you start relying on unnecessary prescriptions, getting off them becomes much harder. Your health is too valuable to leave in the hands of habit or convenience. Number 2, don't let your doctor rush through your consultation. Your health isn't a 5-minute checklist. Margaret, 58, had been feeling off for months, constant fatigue, dizziness, and joint pain. When she finally visited her doctor, she barely had time to explain her symptoms before he scribbled a prescription and sent her on her way. Total time, 3 minutes. No questions about her diet, her stress levels, or whether the symptoms were connected. She left with more pills, but no answers. This is the reality for many. With overloaded schedules, some doctors move patients in and out like an assembly line. They may not mean harm, but a rushed appointment can miss warning signs, lead to misdiagnoses, and push unnecessary treatments. But here's the truth. You deserve to be heard. Your concerns matter. A proper consultation isn't just about treating symptoms, it's about understanding the full picture. If a doctor doesn't take the time to do that, they're failing you. What you should do. Instead, take control of the appointment. Before you walk in, prepare a list of your top 3 concerns. Be clear, direct, and don't let yourself be rushed. Ask questions that demand attention. Instead of just stating your symptoms, ask, could these issues be related? What could be causing this beyond just age? Is this the best solution, or are there other approaches? Observe your doctor's engagement. If they seem distracted, rushing, or not fully listening, pause and redirect the conversation. Say, I need to make sure I fully understand my options before we move on. Know when to walk away. If a doctor consistently rushes you, ignores your concerns, or only offers quick fixes, find someone else. A doctor should be your partner in health, not just a prescription machine. Your health isn't something to be speed run. A rush consultation can lead to years of unnecessary medication, untreated conditions, or even a misdiagnosed serious illness. You have every right to demand the attention and care you deserve. Number 3, don't allow unnecessary tests and procedures. Not every test is for your benefit. Some are for their profit. John, 63, had mild back pain. His doctor immediately suggested a series of expensive scans and lab tests. Concerned, John complied, only to discover later that most of them weren't needed. They didn't change his treatment plan, didn't improve his condition, and left him with a hefty bill. What his doctor failed to mention, rest, stretching, and posture adjustments could have solved the issue without any tests at all. Here's the reality. Medical tests are big business. Some doctors, whether pressured by hospital policies or incentivized by insurance, push unnecessary procedures that do little for your actual health. This leads to overdiagnosis, excessive worry, and even risky interventions that weren't needed in the first place. That doesn't mean all tests are bad. Some are essential. But not every test is in your best interest. Some are just routine protocol, and others are purely for financial gain. What you should do instead. Always ask, is this necessary? Before agreeing to any test, ask, what are we looking for? How will this change my treatment? What happens if I don't do it? If the answers feel vague or unnecessary, you may not need it. Don't be pressured into fear-based testing. Some doctors will say things like, just to be safe, or let's rule everything out. That sounds good, but unnecessary tests can lead to false positives, finding issues that aren't actually problems, extra stress from misleading results, unneeded treatments that create more risks than solutions. Get a second opinion for major procedures. If a test suggests a serious issue, always confirm with another professional before making big decisions. One test result is not always the final truth. Trust your gut. If a test or procedure seems excessive, unnecessary, or financially motivated, pause. Don't let the pressure of authority push you into something you're unsure about. At the end of the day, healthcare should be about what's best for you, not what's best for the billing system. Being cautious with tests doesn't mean ignoring your health. It means protecting yourself from unnecessary risks and expenses. Number 5, don't assume all pain is a normal part of aging. Pain is a signal, not a sentence. Patrick, 67, had been dealing with knee pain for years. Every time he brought it up, his doctor shrugged and said, That's just part of getting older. So Patrick endured it until one day the pain became unbearable. After finally pushing for a further evaluation, he discovered it wasn't just aging. It was an easily treatable joint issue. Years of unnecessary suffering, all because he was told to accept it. Here's the truth. Pain is not an inevitable price of aging. It's a warning sign. Yes, our bodies change as we get older, but that doesn't mean every ache, stiffness, or discomfort should be ignored. Many age-related pains are actually treatable or preventable if addressed properly. What you should do instead: challenge the "it's just aging" mindset. If a doctor dismisses your pain as a normal part of getting older, don't accept that answer. Ask, what exactly is causing this pain? Are there therapies, exercises, or treatments that could help? If I were 40, would you still say this is normal? Seek solutions before resorting to painkillers. Many doctors default to prescribing medication instead of addressing the root cause. Instead of just numbing the pain, explore physical therapy, often more effective than pills. Targeted exercises, strengthening muscles around the joint can relieve pain. Anti-inflammatory diets, reducing processed foods and sugars, can ease chronic pain. Consider alternative therapies. If traditional medicine isn't offering solutions, explore acupuncture, proven to help with joint and nerve pain. Chiropractic care can address misalignment issues causing discomfort. Massage therapy eases muscle tension that worsens pain. Monitor and track your pain. Keep a log of when your pain appears, its intensity, and what makes it worse or better. This helps you advocate for yourself when discussing it with doctors. Pain isn't something you should just live with. It's your body telling you something is wrong. The sooner you listen and take action, the better your quality of life will be. Number 6, don't allow your doctor to dismiss your concerns. If they don't listen, they're not the right doctor. Lisa, 59, had been feeling drained for months. Constant fatigue, brittle nails, and unexplained weight gain. When she voiced her concerns, her doctor barely looked up from his clipboard and said, "It's probably just stress. Get more sleep." But Lisa knew something wasn't right. She pushed for further testing and discovered a serious thyroid condition that had gone untreated for years. If she had accepted her doctor's indifference, her health would have continued to decline. Too often, patients, especially older ones, are brushed off with vague reassurances or generic advice. Doctors aren't always right, and they aren't always listening. Some assume symptoms are just part of aging, while others are simply too busy to dig deeper. But here's what you need to remember. You are the expert on your own body. If something feels off, don't let anyone, no matter their title, convince you otherwise. What you should do instead: stand firm and demand attention. If your doctor dismisses your symptoms, don't back down. Say, "I understand that, but I need you to look deeper into this. What tests can we run to rule out underlying issues? I'm not comfortable leaving without a clear explanation." Track and document your symptoms. Doctors take concerns more seriously when presented with data. Keep a record of when symptoms started, what triggers them, how they impact daily life. Bring this to your appointment as evidence that something needs to be addressed. Seek a second or third opinion. If your doctor refuses to investigate further, find another one. A great doctor values your concerns and works with you, not against you. Trust your instincts. No one knows your body better than you do. If something feels wrong, it probably is. Don't let authority override your own awareness. Being ignored by a doctor isn't just frustrating, it can be dangerous. Your health is worth fighting for. If a doctor won't listen, find one who will. Number 7. Don't rely on just one doctor's opinion. One doctor's opinion is just that, an opinion. George, 61, had been struggling with severe hip pain. His doctor took a quick look at his x-rays and immediately recommended surgery. No alternatives, no discussion. Just a straight path to the operating table. Something didn't sit right with him, so he sought a second opinion. The next doctor suggested physical therapy and minor lifestyle changes instead. Within months, George's pain was gone, without ever needing surgery. This happens more often than people realize. Doctors are trained professionals, but they are not infallible. They have biases, limited perspectives, and varying levels of expertise. A rushed diagnosis or a one-size-fits-all approach can lead to unnecessary treatments, expensive procedures, and avoidable complications. One doctor's recommendation isn't the final word on your health. If something feels extreme, unclear, or forced, seek more opinions. What you should do instead. Always get a second opinion for major decisions. If a doctor suggests surgery, long-term medication, or a serious diagnosis, don't commit immediately. Consult another specialist to confirm. Ask for alternative options. A good doctor will offer multiple approaches. If a doctor only gives you one solution, ask, are there non-surgical treatments I can try first? What are the risks of waiting before deciding? Have you seen success with other approaches? Do your own research. Understanding your condition and the latest treatments helps you make informed decisions. You don't need a medical degree, just awareness. Choose a doctor that aligns with your values. Some doctors are quick to push procedures while others prioritize holistic approaches. Find one who respects your health philosophy. Your health is your responsibility. No single doctor has all the answers, and the wrong advice can cost you time, money, and well-being. Take control, explore your options, and make the best choice for your body. Your health is in your hands. Doctors offer guidance, but you make the final decision. Now that you know what to watch out for, don't be afraid to question, challenge, and take charge of your health. A doctor's advice is important, but your awareness is just as critical. Which of these 7 steps resonated with you the most? Share your thoughts in the comments. I'd love to hear your experiences. If you found this video helpful, give it a like, subscribe to the channel, and turn on notifications so you never miss a life-changing tip. Stay informed, stay strong, and always put your well-being first.